So as we all know, Xinfadi wholesale market has been closed since June the 13th. So some of the pork and beef and meat have been transferred to Yuegezhuang market. So some of these products will be sold in the Yuegezhuang market. So what preparation has been done by the Yuegezhuang market? In order to facilitate the food supply, we have done a lot of work in Yuegezhuang market, for example, for the beef and lamb, as well as pork. We have started to receive orders from the suppliers, and all of the products will be shipped directly to Yuegezhuang market. So some of these supplies will be taken over by Yuegezhuang market. So before June the 11th, the daily supply of pork is around 800 pigs, and for Xinfadi, it will have around 900 pigs to be sold in the Xinfadi market. So on the day of the closure of Xinfadi market, we started to take over the sales of pork. So on that date, we actually started to sell 1,500 pigs. So what we have done has ensured the food supply for the city. And with the development of the epidemic, for some of the restaurants, they temporarily closed down. So we could see there is a decline of the demand of the food for those restaurants. But in general, Yuegezhuang market can provide sufficient supply to the market, especially for vegetables. In the past, on a daily basis, the transaction amount is about 900,000 kilograms. So now we could see the Xinfadi market has been temporarily closed. However, the supply in Yuegezhuang market has been increased by 120%, meaning that the daily volume has been reached around 2 million kilograms. So that is to say that we are able to provide sufficient vegetable supply to the market. So this is actually a collective industry in Yuegezhuang village. Can you tell us about the history of the Yuegezhuang market? So we all know 12 kilometers from Fengtai District, we have the largest wholesale market, which is the Xinfadi market. So can you tell us more about the history of Yuegezhuang market? Well, we have a very sound history. Actually, back in 1958, Chairman Mao had actually made a personal visit to the Yuegezhuang market. He inspected all the food production in the market. So with the reform and opening up, we could see there is a rapid development of Yuegezhuang market. Inside of the village, you could see some of our farmers and workers there growing their own vegetables, and they're bringing their homegrown vegetables to the market for transaction. And with the development of the Yuegezhuang market and some of the nearby villages, they started to bring their vegetables for transaction. So with the increase of the demand, we have more people coming here for the transaction. So back in 1986, our municipal government have decided that we should set up a market in Fengtai District, right in the Yuegezhuang village. So actually this is a farm that was located in Yuegezhuang village. We have made a lot of renovation in the farm, and we have invited a group of residents to come here to help the organization and the management of the Yuegezhuang market. So now you could see a guide map in these places. Even though it is not large in size, only accounts for 25% of the Xinfadi market, But when people are coming here, they can get everything they need. So what is the business model for the Yuegezhuang market as compared to Xinfadi market? So for Yuegezhuang market, we focus on delivery service. So we are taking up 42% of the delivery service in Beijing, and we are carrying 92% of the delivery service in Fengtai District. So even though we are not large in size, but we have everything you need. Sometimes we could see some buyers and merchants coming here, and actually they can get whatever they need within 1 hour. It is quite convenient for shopping in Yuegezhuang market. And also we are providing a lot of services to facilitate the loading of the merchants. And we made a lot of renovation in these places, and we actually built a new parking lot. This can bring a lot of convenience to the merchants. So for these merchants, they can enjoy a one-stop service. First, they can park their vehicles in the market, in the parking lot, and also they can use this kind of a tricycle vehicle to bring the vegetable back into their vehicle. So actually, you could see a lot of this tricycle vehicle in the Yuegezhuang market. So all of this food can be delivered rapidly to the transportation vehicle. So maybe we can take a ride of this tricycle vehicle and have a close look of the Yuegezhuang market. And we just talk about the differences between Yuegezhuang market and the Xinfadi market. However, if we look at some of the varieties of the vegetables, we may say some of the vegetables are actually supplied by the Xinfadi market. For meat and seafood products, we actually directly receive from the supplier. So actually it is quite similar to how Xinfadi operates. Before the epidemic, we directly received the food from the supplier. For some of the vegetables and fruits, 30% of the supply are coming from Xinfadi market. So we receive the order from Xinfadi, and then we are responsible for the delivery work for all of these foods and vegetables. Now we could see Xinfadi market has been temporarily shut down, and according to the requirement of the local government, we are taking over some of the responsibility of Xinfadi markets. That is to say, we are responsible for the food supply, especially for the meat and the seafood as well as fruits. Especially for pork, as I have just said, on the day or when Xinfadi market closed, the sales of the pork is about like 800 pigs, and on the day of closure, we immediately take over the sales of the food. On that date, the sales of the pork, it is equivalent to 1,500 pigs. So that is to say, some of the meat supply can be transferred to Yuegezhuang market. Does that mean we have the same supplier? Well, actually, for the pork supplier, we have the same amount of suppliers. They are providing this pork to the supermarkets and the wet markets in Beijing. That is to say, when Xinfadi market closed, and some of the suppliers, they are starting to send out their food, meat, to the Yuegezhuang market. So before June the 11th, for the vegetables, the daily supply is about the 900,000 kilograms. However, according to the requirement from the Commerce Bureau, when the Xinfadi market was shut down, we have to take over the responsibility of the vegetable supply. So that's why we renovate some of the places and transform those places into the parking lots, so that we can provide better services to the merchants. So right now, the vegetable supply can reach 2 million kilograms. That is to say, we take over the supply for the meat as well as the vegetables. So right now you could see your capacity has been improved, so you have to do a lot of preparations, right? Because in the evening you could see some of the trucks have to be entering into this place and to bring food and deliver the food to the market. Well, we always talk about to ensure the supply. However, we have to ensure the supply on the basis of epidemic prevention and control requirements. We have strictly abide by these requirements. We're making sure that for people who are coming inside of the Yuegezhuang market, their body temperature has to be checked, and we have to do a thorough disinfection to all the public facilities. For all of these public facilities, and we could see we have special task force to conduct the disinfection work. For example, for this truck, they have to do a constant disinfection to these places. So for this kind of truck, they're responsible to disperse the disinfectant on a constant basis. So every 7 days we will have a comprehensive disinfection for this place. And also we receive some supplies from the general public. After Xinfadi market closed down, we immediately activate a mechanism which enables every one of the workers of the market can receive nucleic acid test. (5,138) workers in the Yuegezhuang market received NAT, and all the results show negative. And also 155 external samples have been collected for nucleic acid test, and all of those samples tested negative. That is to say, it is safe to conduct transaction in the Yuegezhuang market. So now we are about to enter into the vegetable transaction hall. Let's take a look. As you have just said, the sales volume has increased by 4 times as compared to the previous days before June the 11th. Actually, we have some direct sale suppliers who are providing food supply in Yuegezhuang market. Since the outbreak of Xinfadi, some of the suppliers may have some close contact with Xinfadi market, have been brought into centralized quarantine. We are making sure that all the merchants can receive the nucleic acid test. If they do not have an NAT certificate, we will not allow them to do transactions in our market. So we are receiving these supplies from Gaobeidian in Hebei province. How did you deliver this food? We have contacted directly with the market in Hebei province and bring this food back in Yuegezhuang market. And before the epidemic, we received all of those supplies from Xinfadi market. But since we have a cluster outbreak in Xinfadi, we started to receive this vegetable from Hebei province. And how about the price? I think the price is quite stable, and we also have a sufficient supplies. So did you increase your price of these vegetables? Well, actually it's somewhat similar. So as you have a direct delivery of all of this food, so you can make sure that you have sufficient supply, right? Did you take nucleic acid test? Yes. Negative? Right. We have received the test results yesterday, and all of our merchants are tested negative. So as a wholesale market merchant, do you think you have faced a lot of pressures because of the outbreak in Xinfadi? Yes, we do have some pressure. However, we do see very effective prevention control measures taken by Yuegezhuang market. You could see we have an all-day disinfection for the market. Well, the background is quite noisy, but I'll give you a general recap of what he has said. He's saying because of the outbreak of the epidemic, and he felt quite safe because in Yuegezhuang market they have conducted disinfection on a daily basis, so they could feel they're very safe in doing transaction in Yuegezhuang market. And actually, we are spacing out all of these merchants in the Yuegezhuang market. Start from day 2 of the Spring Festival, we started to take over some of the supply work in Beijing city. We started to transfer some of the supplies in our market, and we invite some of our merchants coming back to the market, and they will receive inventory from other provinces. And there may be some rumors saying that we are out of stock, but that is just rumor because we have sufficient food supply in Yuegezhuang market. Indeed, it is a good news to all the residents in Beijing. So maybe just for a few couple of days after the epidemic occurred in Xinfadi market, and some of the small size market may feel pressure to receive supplies because they are heavily dependent on the supplies from Xinfadi market. But for other wholesale market, I don't think there's a big impact to all of them. If you watch the news, you will see for some major large-size supermarkets, they also receive a sufficient supply from the markets. And for Yuegezhuang wholesale markets, we are taking over a lot of supplies for the seafood and meat. We have sufficient food. And even though we have a slight increase of the price, but it's not a big increase, we effectively allocate some of the resources to our market. And right now, I would say the price is quite stable. Alright, this is the vegetable transaction hall. Now I would like to take a look in the meat market. I believe many people are concerned about the supply and the price of the pork. And you just talked about Yuegezhuang markets focusing on the delivery service, so especially you are delivering some of the food to the restaurants. All right, once again, let's hop on to the tricycle. So I think right now many restaurants, they have a higher demand for the seafood. So before June the 11th, the daily transaction is about 120 tons, and yesterday the transaction amount for the seafood is only 30 tons. We are directly providing all of the seafood supply to hotels and restaurants, and they have a higher demand of the seafood. And now some of the restaurants are temporarily closed. And also we could see Beijing have taken a very stringent measures in prevention and control. And I believe with the situation getting better, and we will recover the sales of seafood. I'm quite confident in that. As I have just said, for our market, every worker will take a body temperature. Every one of them will wear face masks. We will roll out disinfection to all the transaction vehicles and the public facilities. I believe this is quite safe to conduct a transaction in the Yuegezhuang market. If we have a good environment, I believe our sales will go up again. Even though right now we have a slight decline of the transaction amount, so right now we may have some adjustments for the delivery service of this food, right? In the past, we were delivering this food to the restaurants, and right now we are actually delivering some of the food to our local residents. But for those residents, maybe they have a higher demand of meat as opposed to seafood. But I think with the containment of the epidemic, I believe people are changing their living styles. For example, in the future, they will purchase same amount of meat and seafood. Well, I'm saying that if their living quality is improved. So for the market, people have to place an order one day before, and later on, they will collect the food they have ordered. In this way, we will not waste some of this stock. That's right, especially I'm saying for meat. So each day we will receive orders, and on the other date we will deliver all of those orders. So now we are arriving at the wholesale hall for the meat. Before the epidemic, our business hour is from 9 to 12, but now we have adjusted the time from 8 to 12. By making these time adjustments, we can improve the supply of the meat. At 8 a.m., some of the suppliers will arrive at this transaction hall, and first they have to receive the disinfection for their transaction vehicles, and later on these people will have their body temperature checked. Then they can enter into this transaction hall. Now we could see there is a docking platform. In this place, some of the food can be unloaded. As I have just said before, June the 11th, and the sales in Yuegezhuang market is about 800 pigs, and in Xinfadi market they are selling 900 pigs. But right after the outbreak of Xinfadi, then we are able to sell 1,500 pigs per day. We are fully prepared. If the situation gets worse, and on a daily basis, we can sell 3,000 pigs on a daily basis. Of course, we have to consider the needs of our local residents. So when necessary, we will allocate meat to Yuegezhuang market to meet the needs of local residents. Actually, we are receiving the orders from the same amount of suppliers, because we will not stock all of this food, we receive orders in advance, and later on we will provide the delivery of the pork to the public. So where is this place? Well, this is actually the basement transaction hall. On the first floor, we have a wholesale and the retail of the beef and lamb. So let's take a look on the situation of the pork transaction hall. So if you're not visiting the wholesale market, you may be surprised that there are so many stalls inside of the market. So for in these places, the local residents can visit this place and purchase beef and lamb. So on a daily basis, we will conduct disinfection to these places. After we close the market, again, we will have a thorough disinfection on the ground and on each one of the stall. And we will use the 8-4 disinfectants to do the cleaning. After all the people leave the market, we will also use the X-ray to do the disinfection. So earlier, the Beijing CDC collected 155 external samples for testing, and all of those testing results show negative. This is thanks to the good disinfection conducted in Yuegezhuang market. So we have to be cautious because after we found the cluster outbreak in Xinfadi, we also found 2 other markets have sporadic cases. Well, we have to put prevention and control as our first priority, and later we can ensure sufficient food supply and food safety. Now I can see all of these merchants, they are wearing facial masks and gloves. So for Xinfadi market, we saw many people are infected. However, for some merchants, they are not infected. This is because those people are taking very strict prevention and control measures. They are wearing masks. They are doing a very good job in the disinfection. So this will reduce the risks for them to get infected. And you could see all of these people are using mobile payments. For example, for this store, I believe they already completed the transaction today. Well, I would want to have an interview with this gentleman. So hello, we are now in the live streaming. I would like to ask you a few questions. So did you order all of these meat one day before? Yes, we placed the order one day before, and after I sell all of these meats, so I'm off today. So all of these products are brought from the wholesale market, and I would say the sales is quite good and quite stable in these few days. Yes, we are providing the retail services to their local residents. What's the price differences? Well, not much changes, I would say. So I can see there's not much impact to the merchants who are making transaction in the Yuegezhuang market. And on the other side, it is the pork stall. Even though in total the size of the Yuegezhuang market is not as big as Xinfadi market, but for the meat transaction hall, is more or less similar to Xinfadi market. It is also one of the largest market in the Fengtai District. For our wholesale market, it is one of the market that established the first group of markets established in the 1980s. And back in 1980s, the government have sent out an instruction to set up this wholesale market. For the Yuegezhuang village, they're actually dependent on this Yuegezhuang market to develop their economy. So how many merchants we have in this market? Well, around 2,700 merchants in this market. Well, I would say these merchants, they're operating the stores. Our villagers, they're responsible in managing the market. So in these places is the pork transaction hall. So maybe we can take a look in the seafood transaction market. So what is the price for pork? It's about 23 yuan per 500 gram. It's a little bit increased compared to the situation before the epidemic. Well, for some of the pork is we are receiving from other provinces. Some of the vehicles are not able to leave Beijing. It's a little bit difficult for us to transfer this pork from other provinces. So after the epidemic is over, maybe the pork price will be stabilized. So for Yuegezhuang market, start from 16th of June. In these places, in this region, actually it is in medium risk. So it may have some effect of the suppliers. But now we could see all of the workers who are making transactions in Yuegezhuang market, they are testing negative in the NAT. Maybe people will feel more safe in doing transactions in the market. So yesterday we have received the results. So around 6,000 people, they are testing negative in Yuegezhuang market. So we open up more channels for the suppliers to come in. Because of the epidemic, people are quite panicked in purchasing food in the market. I think in this case, we have to publish all the available information. So the residents, the buyers, they will feel more safe in coming inside of the Yuegezhuang market. And at the same time, the merchants will feel safe in making transactions in the market. Well, indeed, we could see there are many trucks here doing this infection, and especially for over 5,000 people, they are testing negative of the NAT. So this will actually boost the confidence for our residents and the consumers. So we are doing what we can to ensure sufficient food supply and food safety. Thank you. Thank you for your introduction about the markets. Thank you for your coverage, because we are actually taking a lot of job in Beijing right now to provide sufficient food in Beijing. I believe with the strong leadership of the local government, we can complete the task. Also, to all the netizens, please rest assured to come back to Yuegezhuang market. Well, I could see right now not only our healthcare workers are providing support in fighting against COVID-19, also some of the market operators, they are making their own contribution in fighting against COVID-19. Well, that's my part for this live streaming. Thank you. Dear viewers, good morning. I'm Wang Feng from CCTV. Now I'm standing at the NAT sample collection site in Xicheng District. As I have just said, the daily capacity is about like 3,000 to 4,000 samples per day. And to date, it is expected that we will receive 12,000 samples a day in Xicheng District. And now you could see people are queuing for receiving the nucleic acid test. So today I will bring you some updates on the situation of the operation of the NAT testing site in Xicheng District. And we are honored to have a community director in Xicheng District to give us some updates on the sample collections in Xicheng District. Well, this is the testing site in Xinfadi of Xicheng District. Now you can see people are standing here and forming a long queue to receive the NAT test. So now you can see the environment is quite clean here. And also we are setting up the 1 meter line. And all of our residents, they are participating in the NAT test in an orderly manner. Actually, this place is a forest park in the Xinfadi area, and for this park, it is about like 10,000 square meters. It is quite a good environment in the Xinfadi area, and I believe some people are quite anxious in receiving the nucleic acid test. Well, I can see many people are queuing for receiving the nucleic acid test. We have several considerations in setting up the testing site in this place. We are putting this testing site in the forest park, and this place is actually the buffered area. And later on, you will see the NAT sample collection site. We have setting up the 1 meter line, making sure that all the people can proceed with the testing in an orderly manner. On June the 17th, we started to set up this testing site in Xicheng District. We're spending like 12 hours to set up this testing site in Xinfadi of Xicheng District. And later on, you can take a look on some of the facilities in this testing site. So what is your consideration to use this forest park as the testing site in Xicheng District? Well, first we need to have a spacious place with good ventilation. And also in this place we can do thorough disinfections, and we will mitigate our impact to the residential areas. That's why we're choosing this forest park as the NAT testing site. And in this place, we have a temporary quarantine place. So before we enter into the testing site, we will go through a temperature check. So if some people have developed unusual body temperature, these people will be brought into this temporary site for isolation and quarantine. For these 2 days, I believe our residents in Xicheng District, they are quite cooperative. Also, we have a public toilet available, and we are doing disinfection to all of these toilets as well. Right, this is the waiting area. We have 8 channels, 8 passages leading to the sample collection site. You see people are from different communities. They are lining up to receive the nucleic acid test. So all of these places opened from 9 a.m. So we are conducting the nucleic acid test to different communities of the Xicheng District. So some of the party leaders, they're actually organizing all of the testing for residents from the local areas. So I would say at this time it is not a peak hour. You could see some of the passages are shut down because we are arranging an off-peak sampling for the residents. And at the beginning you just said, and today it is possible that 12,000 samples will be collected today. So if we open up all of these passages, so meaning that today the highest amount of the samples can be collected amounts to 12,000. And all the health workers, they are well prepared to collect the samples from the local residents. So later we can go to the sample collection site to have a closer look. So how many sections we have? We have the 3 major areas. So at the beginning is the entrance of the forest park, which is the buffer zone. So meaning that people are queuing to receive the test. And the second section is the waiting areas. So actually we are making use of a soccer field for this forest park. So you're talking about a specific term, the spacing areas. Can you tell us more about these spacing areas? Well, actually we have many vacant places, vacant sites inside of the forest park. We are collecting feedback from the local residents, and also we think in this vacant place is very suitable for people to conduct daily exercise. So we are transforming these places into a soccer field, so people can do exercise, come here, and for this specific time we can transform these places as a NAT testing site. Now you can see we are setting up the 1 meter lines and also making sure that we can reduce the amount of gathering and all the people can exercise social distance. Now you could see each one of them have been exercising at 1 meter distance with the others. This is quite disciplined for all of these residents. And we're also providing some of the education to the public. And I believe with month-long strike of the epidemic, and these people have already improved their awareness in the prevention and control. So all in all, I would say the Xicheng District is in a low risks. It's a low risk area. That's correct, because every day we could see the press release, and right now we do not see any confirmed cases happened in Xicheng District of Xicheng District. When we are running this NAT test, we could see that we can make sure that all of these people can feel safe in their health. So we should organize all of these activities in an orderly manner. You can see the CPC members, officials, they're actually leading the communities to receive the NAT test. Alright, and this place is the sample collection site. And in these places, we are doing a daily disinfection. So in these places, it's actually the disinfection pad. And we have to put the disinfectant constantly on this place. You can see here we have been setting up 8 tents. And first of all, the residents have to register their personal information, and later they will receive the sample collection. Today, what is our plan? How many samples will be collected? Well, we are fully prepared, and right now we are arranging 4,000 residents in the morning section. However, we will consider the real-time situation. Well, actually, that is not the case, because for each district and for each street community, we have set up this NAT testing site. For each one of the streets, we have 2 testing sites available. For this place, we have set up on June the 17th, on June the 18th, 19th, and today is actually the 3rd day since we opened up this testing site. And yesterday we have received 4,000 samples, and the day before we received 3,000 samples. And for the medical workers, they are already familiar with the procedures, and also our residents are getting used to it. And we always say that we have set up this 1-meter line, but still there's a large group of people gathering in this testing site. So what is your consideration to this concern? Well, here you could see it is quite spacious, and we have very good ventilation. However, I would say the body temperature, the temperature is very high for the day, and especially for the medical workers, they have to wear the protective suits. I think it is very difficult for them to conduct such a work in such a high temperature. So what measures have you taken to help to provide support and assistance to these medical workers? Yes, we have taken some of the measures to help to comfort some of these medical workers. We have bring some of the fans here so that it will help them to cool down the body temperature for some of these medical workers. And we set up some of the tents so people can stay in shades. Well, you could see all of these residents, they're exercising social distance at 1 meter or even 1.5 meters. Now you could see we have fans available here, so hopefully the medical workers can feel a little bit comfortable if we have these fans available. So I believe all of the people are concerning about the medical workers because it is a very tough job for them to collect the samples in such a high temperature weather. Well, this is the testing site. Now you could see the medical workers are collecting samples from the residents. As I've just said, this place was a soccer field. Now we have transforming some of these soccer fields into the sample collection points. You could see after they collected the samples from the residents, they have to do a disinfection on the surface of the table. Well, it takes around just a couple of seconds to complete the sample collection. Alright, this is the general update for the NAT testing site in Xicheng of Xicheng District. Any other comments to add? Well, we have several group of people. We have these medical workers, and also we have some community volunteers to help to maintain the order in the NAT site. Well, actually, especially you're focusing on people who are below 35 years old, and all of those officials, they're coming on site to maintain the order. So, well, actually, you are responding to the leading group in Beijing because they're empowering CPC members and the community officials to go down to the communities to provide support to the testing. Yes, and today for the Xicheng District, we have 40 members of the community coming to the testing site. They're working together with other officials to maintain the order in the Xicheng District of Xicheng. Well, we have another special guest inside of the testing site, and he will brief us more updates about this sample collection. See you later. Now we're entering to the sample collection site. So every now and then, some of the medical workers will come back to these places for a short break. And here is the exit. Red, Dr. Guo is here. This is the party director, Mr. Cao from Xicheng District. So can you give us a short introduction about this testing site? And for this NAT testing site, we have 4 hospitals based here. So for each one of the hospitals, they will send out a sample collection team. So altogether, we have around 80 medical workers to come here to provide the sample collection services to the residents. So every 2 to 3 hours, they will make a shift. So for these places, it's actually not the resting place. So for the other side, it is a place for the medical workers to take a short break. So right now, we have just started the sample collection today. So most of the people, they are working on site, and later on, so we will have some medical workers coming back to this place and take a short break. In this place, they will remove their protective suits. So can you tell us more about these areas? So for all the medical workers, they're wearing sufficient protective suits, including protective caps and gloves, shoes, as well as the suits. So when they are coming back to here, they can remove all of those protective suits. They strictly abide by the requirement of the nosocomial infection management, and also we will provide drinks to the medical workers so they can take a short break in this place. So now you could see for this group of people, they're getting prepared to enter inside of the testing site. So they're wearing the protective suits right now. So now you could see, it feels like they're actually wearing 2 layers of the protective suits. Well, actually, these are 2 different types of the uniforms. And for people who are collecting samples, they have to put on the protective suits, and for the other group of people, they actually register information from the residents, so they're actually wearing different types of protective suits. But no matter which type of the protective suits they're wearing, still, it is quite hot for all of these medical workers. So I would like to interview some of these health workers. Hello, how do you feel? Do you feel hot? Not yet. Well, I think just in a few minutes I will start to feel hot. I can tell you're already sweating out right now. So what is this place? This is the waiting areas, and just after a short break, they're about to go inside of the testing site. So for people who are finished their tasks, they're also returning to this place to take a short break, right? Yes. Still, I would say today's weather right now is quite moderate, but I'm not sure what happens at noon. You are not wearing protective suits, but I can tell you're already sweating out. So let's take a look on this tent. Well, in the morning, maybe the situation is quite good, because we have some wind right now, so when you're wearing the protective suits, maybe it's still okay, but when you arrive in noon, and then you will have the highest temperature of the day. I think it will consume a lot of energy for all of these medical workers, because they're not just putting on all of these suits, they have to collect samples from the residents. So of course we will consider the temperature, and also at the same time we will make a very flexible arrangement for their working hours. We have to make sure that they have enough energy and break. So what is the working hours for these people? Well, every day this process will last until 11 or 12 in the evening. So for all of our medical workers, they will arrive here around 6 or 7 a.m. in the morning, and the whole procedure will last until 11 p.m. or even midnight, because we also have to pack all of our stuff and clean and do the disinfection in the public facilities. And today we are at the Xinfadi testing site in Xicheng District. And in Xicheng District, actually we have set up 34 NAT testing sites. And in Xicheng District, actually located in the central part of Beijing city, because it's very close to the Tiananmen Square. And for the Xicheng District, it is to the northern part of Fengtai District. It is affected by the outbreak in Xinfadi. Right now, over 100,000 people in Xicheng District have completed nucleic acid test. So my question to Mr. Cao is, what happens if these people are tested positive? Well, if we found some people are tested positive, of course we will follow the regulation from the municipal governments, and we will transport these virus carriers to designated hospitals, and also we will conduct epidemiological investigation to these people and track down their close contact. Right now, I can feel it is quite comfortable because we are not having a very strong sunlight, and people are taking this nucleic acid test in the forest park. I hope today will be a pleasant experience for people who are receiving the test today. And even though the Xicheng District is still a low-risk region because we have not yet identified any positive patients in this place, and by looking at the expressions of the residents and also the medical workers, I can tell they're quite relaxed, but maybe they're still quite anxious. Now it's 10:30. So for this place is open for testing at around 9 a.m. I think the first group of workers has been working on site for around half an hour and 40 minutes. So can you tell us more about the shift of the medical workers? Well, first we will calculate how many people are on site, and then we will see whether we will open up more testing channels. So if there are more people coming here, we'll open up more passages for the people to receive the test. So we'll adjust the number of testing sites in accordance with the number of residents. So actually, when we enter into June, we will see Beijing will enter into rainy season. So what happens if there's rain? Now, actually, you could see there were many tents set up outside of these areas. On Wednesday and Thursday, we have a heavy rain. So if that is the case, we will open up all the channels, and also we will bring people to the sunshade umbrella so that they will not be affected by the rain. But what happens to all the people who are queuing outside of this testing site? So in this place, I can see some of the tents, but what happens outside of these areas? So my question is, what is the maximum capacity? Well, I have to check. Because in Beijing, we will see after we enter to June, there may be more days of rainy days, so maybe we have to do more preparation. Oh, this is a unique feature in Beijing, and the rain will not last for a long time. So when necessary, we will open up more testing channels. So now you could see these people are actually coming from Jishuitan Hospital. They are also coming here to support the on-site testing in Xicheng District of Xicheng District. I believe these people are taking a group photo. Even though they're fighting against COVID-19, but I believe this is a very treacherous moment for all of these people. I would say this is an unforgettable moment for all of these medical workers. I believe for medical workers, they will feel very proud to participate in the fight against COVID-19. I believe when they're thinking back of these days, they will feel very excited about it. Well, actually, I used to put on these protective suits. Because for these protective suits, it will make sure that these people will not be exposed to the external environment. But for this place, because it is an outdoor place, so maybe we do not have to take that stringent measures because the ventilation is quite good. But if I put on that kind of protective suits, sometimes I feel suffocated, especially indoor places. And for this group of medical workers, they're about to enter into the testing site. Wish all of them good luck. And also wish all of the residents safe. So all in all, good health to all. Well, dear viewers, this is my part for the NAT testing site. Thank you. Dear viewers, good morning. I'm at the Ritandong Road, and this is a new NAT testing site in Xicheng District. And this is quite unique because in this place, people will receive the drive-in test. So meaning that for people who are driving a vehicle passing these areas, they do not have to get off their cars to receive the NAT test. Since the outbreak of Xinfadi epidemic, and we could see some people are queuing to receive the NAT testing, and in different places in Beijing have set up temporary testing sites. So for this driving testing site was established on June the 16th. So let's take a look what happened here. Now you could see some of the cars have been entering into this site, and these people are waiting to receive the NAT test. So can you give us an introduction about this place? So I'm the group leader and person in charge for the NAT testing site here. So can you tell us more about what happened in this driving testing site? Especially can give us an introduction about the procedures of this test. Well, we have a different sections here. We have different sections. We have a preliminary testing site. And first, people will receive temperature check, and later, and they have to provide their health code and show their appointment information. You could see people are driving vehicles and coming inside of this place. So as this place was set up as a driving testing site, and why there were so many people are making a queue here? Well, actually here we have like two channels. So one channel is the driving testing, and for the other side is the regular NAT testing site. So again, can you tell us more about these procedures of the testing? So first I would like to talk about the drive-in testing procedures. And first people will receive a body temperature check, and then they will show their ID card. And these people have to fill in a information card. And we will provide them a specimen bottle, and then they will receive the test. Well, that depends on how these people are coming to this place. If they're not coming here with a car, they don't have to go into the drive-in testing site. Well, first we have a preliminary channel to screen out all of the residents. So first they take their body temperature, and then they will go to a second stop so that they will show their ID card and personal information to our medical workers. So in this place, it is the drive-in testing site. So you could see these people are still in their cars. So for our medical workers, they will provide information card to these people so they can fill in all of this information inside their vehicles. So how long it takes for the whole procedures? Actually, for the sampling, it takes less than 1 minute. but some people are making appointments and they have to register their personal information. So if there's not a traffic jam, I believe the whole procedure will be completed within 4 to 5 minutes. Well, so for this one, I could say he's still waiting for the sampling. So where is the sampling site? Well, he has not yet completed all the procedures because in the next stop, he has to register his personal information. So actually, this is a one-stop service for the drivers. So in this place, and the drivers have to show their ID card, and we will also disinfect all of their ID cards and their personal information. So after we complete the registration of the information, we will bring all of these documents back to the driver. Now you could see we are actually disinfecting some of the ID cards and the medical record for all of these drivers. So disinfection is the key for the prevention and control. So for the next stop, it is the sampling site. For the drivers, they will bring their specimen bottle where they can receive the sampling. So in the morning, we will arrange 4 nurses here to do the sampling work. So 2 in one group, and when necessary, we will do a shift. So if there are too many people, there are not too many people, we will have like 2 groups of people working together. So for these nurses, they're actually putting the protective suits. They are wearing facial masks and also the gloves. And for each one of the customers, they have to change their gloves. So this is the standard for the sampling. So you have to change your glove for every one of the sampling. Well, just a few seconds for me to change the gloves. Right now, we could see these medical workers, they're collecting samples from the drivers. So we have more drivers and more vehicles coming to here. Maybe we will have like 3 nurses to conduct the work. Well, again, we can see the whole process is quite ordinary, and actually I made a rough calculation. It takes no more than 10 minutes to complete the test. So on the regular cases, so 4 to 5 minutes is required to complete the testing for the driver. So in this place, we could see it is not a large size of place, especially in the entry and exit points. So what measures have you taken to avoid traffic jam? Well, that is a good question, because right now we could see many people are waiting to receive the nucleic acid test. So by doing that, we have to increase our personnel. We have different stops. At the beginning, we have only 3 people working on the first stop, and now we have 5 people, 5 medical workers available. But right now, we have some support from the local communities and also the medical institutions. By doing all of that, we can avoid massive gathering. So by doing all of that, we can make sure that there's a limited people entering this place. So for this exit point, you could see it is not that spacious. How can you ensure that there is a smooth commute of this place? Well, we have 2 people here. We have security guard to guide the entry and exit of the vehicles. And also we have some local officials to provide support to us to direct the traffic. Actually, this place is very important because we have to leave this place empty. As you could see, this is a very narrow area, so we have to make sure that the transportation is smooth and all the vehicles can come in and out from these places. So for this place, we have to make that empty so there will not be traffic jam. Now you could see we're doing a very good job here. For example, we have some people here to direct the traffic. If we can pay attention to the details, so that we can improve the efficiency of the testing, and people may have a pleasant experience to receive the nucleic acid test. So what other preparation have you done? So for outside of these areas, we also having more people coming here. The local public security station have provided a lot of support. And also for the hospitals, they also send out some officials and administrative staff here to help to control the traffic. You could see there was some traffic police. They're actually on site to provide guidance to the traffic in these areas. Because in this place, we can tell there is a large amount of traffic. So they're actually doing a good job in managing the traffic condition. So right now, at this time, I think there's not much people coming here. I believe they can complete the sampling. So this is the sampling site. So all of these medical workers, they have to wear the level 3 protective suits. So what is their working hours? We have extended the working hours to the medical workers. Actually start from June the 14th, you could see the workload has been increased. So they will work until 10 p.m. in the evening. And in the morning sessions, we actually have 3 shifts to the medical workers. We also will grant some subsidies to these people, and we have to provide more humanitarian care to these medical workers to make sure that they feel relatively comfortable in working under such condition. For some of the nurses, they're actually injured because of their work. As you know, under such a strong sunlight, it is very difficult to conduct their testing job. And for these people, they have to work from morning to 10 p.m. in the evening. Even though we have 3 shifts, but still, it is quite tough for all of them to complete the job. So for us, even though we are not wearing the protective suits, we are still feeling very suffocated. So for this health worker, actually, she was injured a couple of days before, and she was actually suffered from the sunburn. it's quite a hard job for all of these medical workers. Because for this young lady, she was suffered from the sunburn 3 days ago. How many hours do you have to work? So on that day, I worked from 7 a.m. to 6 p.m. So such a long time I have to stay under the sunlight. I just take a short break and eat my lunch, but on that day there were many people coming here, so I have to work constantly. And today I think the weather is relatively better and I feel comfortable today. But still, protect yourself. Thank you so much for your contribution. You can see all of these medical workers, they're doing a tough job because under such a high temperature they have to wear protective suits and work for hours to complete their task. And they can only take a very short break before they go back to their working position. And especially for some places, and I could see there were a long queue for people who are waiting to receive the testing site. But please understand each other, because right now we have an increased number of people who are waiting to receive the test, and also we have many medical workers who are working at the front line to help to complete the test. And right now Beijing has increased the testing capacity, and on June the 16th, once again, the municipal government has set up these temporary drive-in testing sites. So by doing that, we can reduce the large size gathering and to improve the efficiency of the nucleic acid test. So right now you could see fewer vehicles here today. Is it because we have less appointments? Well, for the appointments, people have to make the appointment through our online platform and also through telephone. So I think this kind of appointment will help to manage the population and to avoid gathering. And I hope with increased number of medical workers, it can also help to improve the efficiency of the test. And if we have more people coming here to provide support, more people can receive tests in a faster manner, and also it can reduce the risk of cross-infection. And many of our residents feel quite safe in coming here to receive the test. So what is the daily amount of samples we collected? So actually start from April the 30th. At that time, you could see the response level has been lowered. However, after the outbreak in Xinfadi, we could see there is a big surge in the number of testing. So start from June the 14th, we starting to receive more samples and more people who are waiting for the testing. So we have to make sufficient preparation to counteract the impact. So that's why we start to roll out this appointment system for people who are waiting to receive the test. For the sampling, actually it is quite fast. It takes less than 1 minute. But still, do we have to control the number of sampling? Because I know it also takes some time for the testing, right? Well, we have some authorized testing centers to test the samples. So for us, we are responsible for the sampling, and we will send out the samplings to the laboratory for the results.